My name's Lucy, one of the hygienists at Confidental. I'm just going to be going over a couple of tips and techniques for the different types of toothbrushing, manual toothbrushes and electric toothbrushes. One thing I would recommend with a manual toothbrush is to get something similar to that kind of size. You don't really want to get a head that's too big, keep it nice and compact. Most people, the mistake they make whenever they're using these kind of brushes is that they will actually not only concentrate on what they're doing, and they will just generally tend to scrub far too hard, which can wear away the gum. So what you always need to do with your toothbrush is just hold it very, very gently. Always try and aim it actually down to the gum line, because a lot of people again will just miss the plaque that sits along the gum line of the teeth. And if you can angle it like that and just do a little area at a time, just follow it around. It needs to really take to go over the whole mouth for about 2 minutes totally for ideal brushing techniques. Same on the inside, again, you just want to angle the toothbrush so the filaments are going onto the gum line. Again, just right down on the gum line. Exactly the same on the top teeth. Again, you always want to try and aim your toothbrush right down onto the gum line. Just follow it around, a little area at a time. And at the end, if you want to have a little bit of an extra scrub and just do a little bit of brushing on the top of the teeth, then you won't do any damage. Another little toothbrush that you can have, specifically if you've got crowded teeth or if you've got wisdom teeth, any area that you've struggled to get your manual toothbrush into, you can get these little tiny interspace brushes. And these are great for going right behind the last molar teeth. You can flick them a little bit in between the teeth. You can run it along the margins of the teeth, basically anywhere that you might struggle to get to. Again, you can just run it along the gum line, give it a little bit of a flick in between. It'll just make it a little bit easier on your regular toothbrushing, just a little bit more effective. And most of the population these days tend to go for an electric toothbrush. And one of the ones at the surgery we tend to recommend is one of these Oral-B electric brushes. The heads are easily available, they just snap on and snap off. And these are actually quite compact, and they will actually do the circular brushing for you. So when you're using one of these brushes, all you would need to do is just place it on each tooth individually, hold it for a few seconds, and then just run it along to the next tooth. Keep running it along the gum line. And the advantage with a brush like this, it has a built-in timer. So every 30 seconds, it'll make a slight noise change. And what you can do then is split the mouth into sections. So you can do the lower right-hand side and then the tops. Again, you're just running along to the gum line, just holding it nice and gently. And again, this will then tell you if you've done exactly sort of 2 minutes. And again, you can just take the extra time and just run it along the biting surfaces of the teeth. And just the same as a manual brush, you can actually get a little attachment head that's called a little interspace head that will fit on the same unit. And again, this is great for any areas where you might struggle to get to with the regular heads. Again, you can go right behind the last molar teeth, right along the inside where the tongue might sit, which some people struggle to get to. Again, you can use it to flick in between teeth, and it's actually very, very good running along the brackets of braces and just getting up and down into braces a little bit more. And these brushes are fully rechargeable, and the only thing really is with the heads on these is to make sure that you replace them really every 3 months.